Welcome to today's lecture. I'm Dr. Wulong Zhuang. I'm endocrinologist. I will show you and share you about the knowledge and the clinical practice experience about diabetic foods. We often describe some food symptoms are caused by diabetic food, but what kinds of food we can call it as diabetic food? Diabetic food is defined as the structure or functional alternation of the food, such as ulceration, infection, and or gangrene associated interaction of different factors induced by maintained hyperglycemia and previous traumatic cause, although the food did not have present lesions. And please notice the key words: neuropathy, peripheral vascular disease, and infection. If a patient has neuropathy, he may lose sensation so that he would have trauma or wounds at the foot easily. Hyperglycemia may develop cellulitis even without having a trauma or injury. Peripheral vascular disease may lead to chronic pain or ulceration symptoms. When you meet a refractory wound, don't forget to evaluate the vascular disease. Diabetic food have symptoms. The symptoms usually they prevent wounds or pain. In clinical practice, patients won't come and say, "Hey, doctor, I have diabetic food." In reality, patients may report pain or wound symptoms. This lecture will focus on wounds or ulceration symptoms. Patients with diabetic foot ulcers or history have an increased risk of 5 to 10 years mortality. But it is not proven yet that healing diabetic foot ulcers improve longevity. Let's talk about cause of diabetic foot symptoms. When patients develop diabetic foot symptoms, if we know the cause of reasons, we will know how to prevent it. There's a great journal paper published by American Diabetes Association in 2018. In this figure, it shows that sensory neuropathy, motor neuropathy, and autonomic neuropathy and peripheral artery disease will put the foot at risk and even lead to foot ulcers. Besides glucose control, our diabetes educator will check patient status during regular clinical visits. We will check whether if the patients have inflammation or infection signs. Let's talk about pathophysiology of diabetic wounds. When we got injury or have a wound, the N1 macrophages and interleukin-6, interleukin-12, TNF-alpha, or some factors will increase, and they will lead to inflammation. And then, in the later time, the N2 macrophage will increase, and this phase will promote healing. The factors like interleukin 10, interleukin 4 will increase. But if a diabetic patient has diabetic wounds, the phase will delay. The N2 macrophage will delay. So the wound healing also delay. There's a hypothesis about why diabetic wounds heal delays. In the medication, some papers found insulin may help diabetes wound heal, but why? And maybe insulin will promote some factors and promote N2 macrophage and maybe increase the healing or wound recovery. And what are risks of diabetic foot symptoms? And as you see, their tables tell us about which patient have urgent risk and high risk or low risk and very low risk. And if we meet a very urgent risk patient, maybe you have to refer to the medical center or specialist as soon as possible. But if a very low risk patient or symptom, maybe you can follow up regularly. In routine clinical visit, you may check the pulse of dorsalis pedis and posterior tibial artery, and whether if the patient loss of sensation about foot protection. The more the patient lows, the higher risk the patient has. And how to evaluate diabetic foot symptoms? There's some categories like wound, ischemia, infection. If the wound have gangrene, it's more higher risk. And if more ischemia symptom, higher risk. If the infection sign more systemic, it's higher risk. Maybe sometimes you don't have a instrument to measure the ischemia, but instead you can make a physical examination to touch the patient's foot to check whether the temperature of the foot is low or high. And as briefly described in the session, you want to improve the care. You have know how to treat the wound, how to treat the ischemia, how to treat the infection. As we see at previous slide, if more wound condition, more ischemia symptom, more infection symptom, the risk is especially high. But if the wound condition is okay, the ischemia symptom is not good, it's still high risk because some patient may develop gangrene if the wound is still small. So you have to evaluate 3 items: wounds, and vascular, and infection.